Hi guys, so in this video today I wanted to talk about some of the common side effects and the risk and complications of filler. It's mostly going to be aimed at lips as that's the main thing that we do here and it's really popular treatment, but it does relate to any area that we're treating with filler. Most of your common side effects are things like bruising, swelling, redness and tenderness to the area. These are all completely normal and can vary in severity. Some people just get a little bit of swelling, some people get quite a lot of swelling, some people get barely any bruises, other people bruise like an absolute peach, look like you've been punched in the face. So yeah, it's really different from person to person. My clients, or you know your body better than I do, so you would know if you're probably more likely to bruise or not. There are things that you can do on the lead up to your appointment to reduce bruising and swelling. I recommend maybe taking a course of antihistamine, which you can just get from a pharmacist, and Arnicare tablets as well, or using Arnicare cream in the area. Again, that's something that you can just get from a pharmacist. If you take those on the lead up to your appointment, you're less likely to bruise and swell, and it will obviously help to reduce that downtime. Like I said, everyone is so different and it can vary from time to time. Sometimes I've been to have my lips done and I haven't really swollen up that much. Then other times I have. Can depend on my immune system, depend on how I'm feeling that day. Depends if I've taken any medication, things like blood thinning medication, omega-3 fish oils, any herbal tablets that can make you sort of bleed more and bruise more and swell more. So those are sort of things that if you are taking, if they're prescribed, I wouldn't stop taking them, because it's not a reason why you couldn't have filler done. It can just be a contraindication. It might be something that you just need to let me know about, so I'm aware when we're doing the treatment. So yeah, I'd always advise people to book their treatment about a week or two before a special event, just in case you do get any of those side effects and you're one of the clients that might get the more severe swelling or severe bruising. Obviously, if you're getting it done a day, 2 days before your wedding day, your birthday, that's not a great idea, just in case you do have quite intense bruising or anything. So definitely leave it about a week, especially as well if you're going on holiday and you're flying. That gives you enough time to, you know, treat it with ice antihistamine, or come back and see me if you need to before you go away on your holidays. So redness straight after the treatment is really normal. The lips normally go quite red, the blood goes to the area, so they can also make them look a little bit bigger than what they will look like when the swelling goes down. That's completely normal. And obviously swelling, you'll get that immediately from the treatment, which will naturally go down. Sometimes it does go up before it goes down though, so be aware that sometimes maybe that evening the lips might feel like they're pulsating, they're tender, they're getting bigger. It will settle down, it's just kind of like a delayed swell. Most people get the most swelling the day afterwards. From where you've been laying down in bed and you've been laying down flat, sometimes when you sit up, the lips can really puff up. They can be quite tender, quite sore and quite big. This is normal. Again, it's just delayed swelling. As soon as you kind of get walking around and your blood flow goes back to normal, they do tend to settle down. So it really is kind of like that 2 to 3 day period where they might be a bit up and down. You know, if you ice them, they'll go down, then the next day they might feel a bit puffy again. But that everyone is different, so how swollen they get and how bruised they are does vary on each individual. Bruising, like I said, we recommend taking Arnicare for on the lead up to the appointment. If not, that's fine if you haven't taken it. Just be aware that obviously with any injection there is a chance of bruising. We are making a puncture to the skin, so you can get a swell and bruise in the area. Bruising, that can take between 2 to 7 days to go, depending on severity. Mine normally clears up in a couple of days, but if it's quite bad, it can take a bit longer. Unfortunately, all you can do really is wait for that to settle down. We do say don't put any makeup on or anything on the area for about 6 hours. So if you have had the treatment done one day and you have work the next day, you can put lipstick on or makeup on around the area the next day, that's fine. We just let clients know obviously to not put anything on because of bacteria, infection, that sort of thing. So yeah, that's your main common side effects. If they feel a bit sore, you can take paracetamol, but generally they're okay. Yeah, I'm booking it before a special event. So the next complication would be lumps. People always say, oh, I'm scared of getting a lump, or I've got a lump. Some people say this like immediately after the treatment. Obviously with the lips, there's so many well, I don't want to scare you, but there's multiple injections, maybe up to 15, 20, something like that. You will have lumps, bumps, swelling, bruising, so you really have to wait until all of that is settled down to know what the final look is of the lips. You'll get that swelling, that initial swell, for 2 to 3 days, and sometimes once those days are over, you kind of feel like that's how your lips are going to be, but there's always going to have an underlying swell. So I say to people, wait 2-3 weeks until you get your final result. In this time, you'll be doing your aftercare and drinking lots of water, so they will change a lot. If you do have a lump and it doesn't go after 3 weeks or a month or something, we do suggest clients to massage the area. Sometimes by just massaging and squeezing the lips, that can help the filler smooth nicely around the lips. I also do this for the client straight after the treatment as well. But if they are particularly bruised, then we just leave it because I don't want to irritate them even more. But generally they just settle down and go away on their own. If they don't go away, it's not anything to worry about or be concerned about. I do get clients to just come in and see me. Some of the common reasons it can happen are if people have really thin lips, or they just don't have much tissue or very thin tissue on the lips. Sometimes if the product's a bit too thick, then that can leave them a bit lumpy. That tends to be the most common reason, or if the filler has been placed too superficially. But as an injector, when you are injecting, you can see sometimes you put the filler in and it can move around the lips in places that you hadn't directly put the filler into. This is normal, it's just the lips are very durable. The filler moves between the layers of the skin. So yeah, it's kind of sometimes a bit unavoidable. It's not sometimes not anyone's fault. It's just, it is what it is. We can help reduce the lumps by either massaging, like I said, or we'll get you in. We can either have a look where the lump is, kind of give it a little squeeze, and we can just squeeze the lump out, and sometimes that then means we don't have to use Hyalase. We try to avoid that if we can. If we have to use Hyalase, that's just the enzyme that breaks down filler. Once it's injected, it dissolves the filler immediately and works up to 48 hours. We tend to use it only really for complications where there's a vascular occlusion to the lips, where the filler's blocked an artery, but that's what I'm going to go on to now. So that's how we deal and manage with lumps in the lips, which are, they can be quite common. Then you won't, I'd say maybe 1 in 15, 20 might get a little lump, but it might go away on its own, so it might not need to be managed by myself. So a vascular occlusion is when a filler blocks or compresses against an artery or the vessels into the lips. Usually there is really good blood supply to the lips, so it's really rare that might happen. I've seen an article where they state that it's 9 people in 10,000 might get necrosis, and necrosis is death of the tissue when the tissue starts to die. It's something that we would manage straight away on site. We use Hyalase, which I just spoke about, which is the enzyme that breaks down the filler. So if that happens, firstly, before we go on to dissolve all the filler, we might be able to just move the filler out the way. It's something I would see straight away as the area kind of goes mottled, a bit grey or white. So if I see that happens, which I'm always looking out for when I'm injecting, we would massage the filler, and if we massage it, it could just be a compression and it might move out the way, and therefore we wouldn't need to go on to the next stage. If that doesn't work, we would use, I've got some little lips ice packs which you can actually heat up, so we'd place that on the lip, which then dilate the blood vessels, so that might be enough for the filler to pass through. So we'd keep doing that and keep kind of putting hot on it, and then having a little massage. If that doesn't remove the filler, then we would use Hyalase. We do patch test this on the arm first to see if you'd be okay to have it. Most people are. Some people, we are just testing for any kind of reaction to the Hyalase. Most people that might be have a reaction to it are people that are allergic to get anaphylactic with bee stings and that sort of thing. So we just test for it first. But in this case, obviously, if there is going to be necrosis of the tissue, we would inject it, and that will break down the filler straight away and allow the blood to flow through the lips freely again. So that is how we would deal with that, and like I said, it's something that we would see on site. The way to test for this, sometimes I feel like when clients leave, if they're like, oh, is this necrosis, is this, what is this? So the best way you can test for it is to do a capillary refill. This is where you press on the area, and then you press on it for 5 minutes, 5 seconds, and then you lift your finger up. If the blood flow comes back to, within 2 seconds, then it's fine. If it takes a longer time, it's very sluggish, then there might be a compression that needs to be sorted out through using Hyalase. But it is, like I said, something that I kind of will see, so you don't have to worry about it so much when you leave. But there are some of the risks. Like I said, necrosis is very rare, and the 9 out of 10,000 people that got necrosis, it was actually half of those were through the glabella region, which is when people fill the frown lines. We don't do that here. I feel like we've got other treatments that would work better there anyway. So Botox, Bocature, any sort of anti-wrinkle injections can help to smooth out that area. And if the line's particularly deep, we now offer PDO threads that can help to smooth back the skin, create a taut appearance to the skin, which can then obviously reduce the deep line there. But yeah, that's the sort of areas that are more likely at risk, where they're not so durable. The lips are very durable, they move around a lot, you can stretch them. So yeah, there's less likely for that to happen in that area. Also, people need to listen to the technician as well. If you've had quite a lot of filler, there's obviously going to be more risk of that happening because of the expansion and the amount of filler that's in there. Every time you have filler, I see some girls, they want their filler done, their lips already have so much filler in there. Every time we're injecting more filler, there's going to be more risk that we're going to restrict the blood supply. So if your technician has said, right, you've had enough filler, I don't want to see you for 9 months, a year, then do listen to them, because they're not just they're saying it for your benefit and to reduce the risks of any more serious complications. But yeah, I hope that's given you a little bit of insight and you've learned something from this video, and we'll be back next week with another video on another subject. So if you've got any questions or if you'd like to see something else, then definitely leave us a little comment and we'll take that into consideration.